Now, I want someone to make me feel good, make me feel as if I'm healthier, brighter and more vibrant on such a dismal day. No better person than Dr. Jonny Bloomfield. Jonny, good morning.
Good morning, Frank. How are you today?
I am good. We're talking Healthspan and Lifespan. Lifespan, of course, is the number of years from you're born to you die. What is Healthspan?
Okay, so Healthspan are the years within your lifespan that are that you would perceive to be yourself in very good or even good health. So that includes your physical health, your mental health, and other dimensions of health. So the life expectancy here in Northern Ireland is 78.5 for men and 82.5 for women. But unfortunately, there's a large gap between health span and lifespan in this country, where the health span, healthy life expectancy for men are around 61 for men, and and about 62 or 63 almost for females. So there's a gap of about 17 years for men and 20 years for women.
So what are you telling me, Jonny, that I'm about to get to? You say 61, like I'm, 18 months away from starting to go downhill. Is that what you're saying?
Well, that's the point of this conversation. Is that should that be inevitable? Should that be something that we see a consequence of getting older and the last quarter or the last fifth of our lives? Should they be in a state of declining health? Is that just a consequence we have to accept, or is there something we can do about it today to prolong our health span? We want to close that gap as much as we can, so that we spend very few of our late years in life in any sort of compromised health situation.
So is it too late for me to take steps? What about someone who's 40? Give them the advice, because I'm doomed.
You're not doomed. So what we do today will impact us tomorrow, and tomorrow being our future, that represents the whole of our future. So if we are doing nothing today, we are probably extending the gap. But what we should be doing is all the kind of healthy habits that we talk about week in, week out around, say, stress management, sleeping well, eating well, moving more, sitting less. Those are key fundamental things, and ultimately we want to try and have higher quality of living for as long as we can. Really, isn't that all of our aim?
Well, this is true, and I probably have, I know I'm personalising this, but I can only really talk about myself. I've taken steps recently to cycle. I'm starting to use the train, where I have to walk, 15 minutes to the train and then 25 minutes to work and 25 minutes back to the train and 15 minutes from the train. So that's a lot of walking if I'm not riding the bicycle, because a morning like that, it's a bit difficult with the bicycle. But I'm not using the car as an option at all. And this is absolutely dang all to do with me losing my parking space in Belfast. Nothing. Mr. McFerry, my boss, don't think for a moment that I'm in any way angry about losing my parking space. Having said that,
maybe done you a favour, Frank.
He's done me a favour. He's done me a favour. Yeah. So I'm now using public transport and I'm using a bicycle. And okay, I'm coming out of the Christmas routine of overeating. I did for a month overeat, but generally I'm cutting back on the sugar and the fat and so on. I listen to Sal Hanvey, who gives me good advice on nutrition. I listen to Deirdre Maguire, who gives me good mental health advice. And, I'm genuinely trying, but I do feel that I'm getting older.
Yeah, well, I mean, I'm taking some inspiration. Obviously, you and I, we had great Granny Molly's 100th birthday last May. So she's 108 months now, and she was caught over Christmas, by unfortunately my father contracted Parkinson's disease over the year last year, but has got himself into a fantastic state of physical condition. He's really embraced the exercise to help him manage and slow down his decline, and he says he's now in a better fitness than he's ever been in his mid-70s. So one of the things he does is got a rowing machine, and then Granny Molly, when no one was looking, at 100.5,
you're joking?
Give it a go. No, I'm not.
Granny Molly at 100 was on the rowing machine.
absolutely what she shouldn't have been. So we quickly put an end to that. But long story. We'll go to it there another day.
I love Granny Molly. It's a picture. I've painted a picture. It's the wrong picture, but I've painted it anyway.
Isn't it the mindset though? The mindset. I am not limited by my age. I am not limited by my what I can and cannot do. I want to give that a go because she used to row in school, 90 odd years ago, and I'm gonna see if I can still do it today. So I love the mindset. My father-in-law is another great inspiration who had heart surgery about 18 months ago, and now does. He's been active all through his life, but he couldn't wait. Now he goes on a bike ride with my wife. So his daughter for coffee one day a week, and it's brilliant physical and social health for them too. So I was reading I got into this author called Peter Attia. He's a medical doctor. He went through Stanford University and Johns Hopkins Hospital, and he wrote a book about longevity called Outlive. And he he was a big into triathlon, and he used triathlon as his purpose and focus for being active and doing his exercise to get faster time. But now that's in his past. He's now going, well, what am I exercising for today? And he then he looked at longevity and he labeled this thing called the centenarian decathlon. So the centenarian decathlon is basically 10 physical things that he wants to be able to do in the last 10 years of his life. Hopefully he hopes to live to 100. But let's say in the last bit, what are the things you'd like to do? Practical stuff as well, like it might be getting out of a chair, opening a jar, being able to pick up a suitcase and go on a flight and put it into the overhead bin, and then or carry your groceries from the supermarket all the way to your car where you've parked at the other side. So you're not limited. Picking up the great grandchild, that would be another one. So a lot of it is based around being strong and stable, having good mobility, so being able to get up, get down, and having good aerobic capacity. So being able to go for like say a hike or something that was a bit more strenuous than you'd see your average. Like my father-in-law in his mid-80s, he's going out for bike rides and so on, and I'm getting really inspired to go, what am I exercising for today in my mid-40s? I want to be able to take my daughter on a bike ride when I'm mid-80s and have coffee with her. And so everything I'm doing now has that focus of longevity, and I want to be able to have full functioning capacities, mental faculties, everything in that last stage of my life. And what I put in, for anyone listening, if you're over 30, this now matters. So you want to make sure everything, all your efforts in your 30s and beyond, is going into closing that healthspan, lifespan gap, so that you have more quality years for as long as you possibly can, and enjoy those as much as possible.
And that'll really help the NHS too, because people will be healthier in their older age.
It should do, absolutely.
Jonny, thank you very, very much indeed. See, you feel better, don't you? You believe that you now can eat properly, get some exercise, have the correct mental attitude and positive thinking, and allow the stress to dilute. What did I tell Deirdre Maguire? Those negative thoughts, just kick the passengers off the bus. Nobody getting on my bus except me and Mr. Positive and Ms. Positive and a whole lot of Ms. Positives and Mr. Positives. Lovely stuff. I'm surrounded by great people. The plus of working on this programme, you've access to Dr. Jonny Bloomfield, you've access to Sal Hanvey, you've access to Deirdre Maguire, and, just for balance, you've access to Kim Kelly. You couldn't go wrong.